This is Aging by the Bay, here to provide families in the San Francisco Bay Area pertinent information about healthy aging practices and services. Your host is Ajay Sani of ComForCare Home Care.
Good morning and welcome everyone to Aging by the Bay, where we provide families in the San Francisco Bay Area relevant information about healthy aging practices and services. I'm your host, Ajay Sani from ComForCare Home Care. With ComForCare, you can give your loved ones the best life possible, thanks to complete in-home care for every stage of life. Find out more at comforcare.com or call us at 1-800-886-4044. At Aging by the Bay, we talk about joys and some of the challenges of growing older in the Bay Area. We talk to experts about what they see happening as people age, as well as the services that are available that you or your loved ones may not be aware of. Today, I have a guest. I think you will really love it, especially what's going on, and there is so much of anxiety. So it's my absolute pleasure to introduce Felicity Burdick, who's a licensed clinical social worker with a specialty in gerontology and the end-of-life transitions. She has been practicing in the Bay Area since 2012. She has worked as a social worker for a hospice agency, as a medical social worker in the Stanford Hospital System, as a medical social worker in the Kaiser Hospital System, and she's currently with Palo Alto Medical Foundation, a division of Sutter Health, working in the East Bay in palliative care. So good morning, Felicity. How are you doing today?
Good morning, AJ, and good morning to all your listeners. This is a lovely sunny day. I'm enjoying it so far. Thank you.
So let's start. And some of our listeners actually may not have a clear idea about what exactly a social worker does. So can you please explain what are the main things a typical social worker does?
That's a complex question because there's very many different fields in social work. Mm-hmm. So I'm going to mention a few of the different practices. There's the field of aging, child welfare, criminal justice, there's addictive behavior, mental health, school social workers, workers in the family services industry, helping homeless people, and then, of course, in the healthcare industry. But they do all have something in common. Their goal with all of them is to help the individuals or the families or groups of people to cope with whatever problems they are facing with the goal of improving their lives. So one of the things a social worker will do is when they meet, say, an individual, they will assess what their needs are, and then they typically will make referrals to whatever resources are available in the community. And one of the primary focuses is to support the dignity and the worth of every individual so that they can promote self-determination based on their own values, which is the important part. The social worker doesn't come in to tell people what to do, but rather to help people to figure out how to do what it is they want, how to accomplish their goals. So I hope that clarifies a little bit of what social workers do.
Excellent. I mean, this is really good and very important. And the thing is that when anything goes wrong, we are not feeling well, it can be really overwhelming for the patient and the family. So now if you look at the current environment, the COVID-19 environment, do you see more stress among people when they are admitted to a healthcare facility?
Absolutely. These times are so stressful on very many levels. But now particularly we're talking about the senior population. And as we know, right now there's a high risk to this vulnerable population because of the COVID virus that's out there.
Right.
But also, in addition to that, the senior population obviously has a lot of illness, which means that they need to go to the hospital or to skilled nursing facilities, which is going to obviously increase anxiety because when you're in those environments, you are going to be exposed to more people that possibly have the virus. So this is a big challenge for families. As you can imagine, If their loved ones have to go to a hospital, they are not allowed to visit.
Right.
And then if they get transferred to a skilled nursing facility, they cannot visit there either. Sometimes the nursing staff are actually trying so hard to be supportive, and they're helping with FaceTime visits. Doctors are doing video visits. But it's heartbreaking and stressful for the family not to be able to see their loved ones. And if I may add, because I think families do need to be aware of this, that if a person is in the end stages of their life and they transition onto hospice services, while that's normally a wonderful support program, if they're in a facility with hospice, they are still not able to visit their loved one unless they are actually in the dying process. And then they may be able to go for a short visit to have their final farewell. But as you can imagine, this is very challenging and extremely heartbreaking. So our heart goes out to people that are going through this right now.
Absolutely. Yeah, you're right. So maybe
I would have to add there's a little bit of positive support in that, you know, when families get through the hospital, or patients do, and then through the skilled nursing facility, once they go home, they can get support at home. There's some wonderful home health care agencies which is ordered by the doctor, and there are some wonderful workers that are going to the home to support families. There's nurses, physical therapists. They can still go to the home, health hygiene precautions, so they can still help people at home. And if a family is able to, if somebody does need hospice service, they can take them home and have extra support coming into the home. So it's possible as well, and it can help get all of that set up.
Yeah, no, this is really great. So would you like to share some examples, please, where patients and family members were struggling and how you helped them?
Absolutely. I'll give you an example of a typical problem that comes up over and over again with many of our seniors. As they age and as they become ill and they find that they're losing control of their physical abilities, they're possibly having financial challenges as well, the family gets overwhelmed, the person themselves feels they're not having enough support to stay at home. They'll reach out to us, you know, and ask us for ideas to help them. So each person is unique. They have their own support systems or their own needs. So we sit down and have a good conversation about what their goals are, what they are able to do, and then we look at what supports there are in the community that could help them to stay at home for as long as possible, because that's what most people want to do. So we'll bring in caregiving or transportation support. We may be able to help with transitions with finances. But if that doesn't work, we have to start looking at where they could move to. And an example that I had recently was the patient was in our East Bay area, but the family was all far away, and they didn't want to move into skilled nursing and be alone up here. So we helped the family to actually wrap up the patient's life in the Bay Area and move them out of state. So we had to help them to get Medicaid instead of Medi-Cal. We had to find a skilled nursing facility in another state that was near where the family lived. And it was a lot of things to coordinate, and the family didn't know even where to begin.
Right.
But we were able to pull it together, and it was a reuniting of a family. They all ended up being so happy, and because it was out of this expensive area, they could manage to move forward and support the patient without having to have them in their homes, which they weren't able to do. So it ended up being a very positive transition, which the family said they wouldn't have known how to manage on their own. So that's fairly typical, that where we have those kind of transitions where people don't know where to begin or what to do.
Excellent. This is such a positive sort of sharing that you have done, that I think the biggest message is ask. Don't be afraid of. You never know what is possible until you try.
Yes, absolutely. That actually would transition into something that I think is important for our listeners to hear, and that is, what are the resources available to them, when they have health challenges, and who to ask. I mean, that's the bottom line, is when you don't know what to do, it's important to reach out. And where do people reach out? So I would like to give some general guidelines, because each county, and there's many in the area, they all have their own specific resources. So the general rule of thumb would be, when you're having health challenges, the first place you want to reach out to is your medical team, because it's important to rule out any medical illnesses that could be causing symptoms that could possibly be cured, and then you might be managing better at home. So first, talk to your primary doctor to rule out any medical issues. And then when you're with the doctor, ask if the doctor has any social workers affiliated with their practice, or how could they refer the person to a specialty where there are social workers. So, for example, somebody who's suffering with cancer gets referred to a cancer clinic. Most cancer clinics have social workers who are very knowledgeable about support resources in the community. Or they may come to a service like one that I work on, which is a palliative care team, where we are actually able to visit people in their homes, or they come to our clinic. And then, I'm the social worker, and I can help refer them to all sorts of supports. So if that doesn't work out, the other place to look is at your local city. Many cities have the most incredible programs. They have supports with transportation, with low-cost housing, all sorts of support. And there's a wonderful group of people that work in the cities that can help seniors. The other place to reach out in whatever area you're living in is the senior centers that are in your neighborhood. They often know where all the support programs are for seniors. There's something else that I would like to mention here, AJ, and this has it's all over the United States. It's federally mandated, but it's run by the state. There's non-profit agencies that fall under something that's called the Area Agencies on Aging. So those agencies are non-profit. There's about over 600 in the country, and they are specifically set up to address the needs and concerns of seniors who are 60 and above. So wherever you live, if you go into Google and you put Area Agencies on Aging and you put your zip code, then you will find which is the closest nonprofit agency for you. And they are a wealth of information. So that's a good place really to go to. And then the last couple of guidances that I would like to recommend, there's obviously Social Security offices, and once you hit retirement age, that they're going to help with finances or Social Security income or disability income. But then there's also something that's separate from Social Security, which is called a social service agency. And if you are having any financial challenges, that's who you should contact. And every county has their own social service agencies, usually more than one. So you can look by zip code for your social service agency, and they would help with general assistance money, Medi-Cal applications, CalFresh food stamps, those sort of things. So there's definitely help out there. You just have to look for it.
This is wonderful. This is like, what you have mentioned in one go. There are tons of things to look out for and ask for help. If you're asking for help, there may be quite a few people who can help. So this is really good. I'm so glad that you are able to provide this information. So now to wrap up, is there any message that you want to give to people out there? Because in general, there is quite a lot of anxiety today when it comes to, health safety. So you can really elaborate whatever you want to explain.
I agree with you, AJ. These times are unbelievably challenging. I think as a senior, it's challenging as we decline in our abilities. But then when you add on to that the current stress, all of the things that are going on in our environment right now, there's a lot of anxiety in all age levels, and families are really struggling to cope. So one of the things that we need the most is patience, which is easy to say but hard to do.
Yeah.
And what we're hearing messages every day is how we need to be careful about our personal safety, and we need to distance ourselves, and we've got this constant reminder from, the CDC guidelines on how to be careful with our hygiene. So we're bombarded with all these messages. So what I would like to say, it's super important to get relief from that input. So we've got to relieve the stress, and in order to do that, we each individually have to find the best way we can to remain calm, to be centered in ourselves and to remain calm. And there are so many things that we can each do with no cost to ourselves to find our calm center. I'll give you some examples, but each person will find their own way. So if you have spiritual connections that you can use for inner strength, or if you have family or friendships you can reach out to help support you. And if not, there's beautiful music which can uplift our nature. And then nature itself, if we can go out into the environment and absorb the beauty and get pleasure from being outdoors. Some people can still enjoy physical activity like Tai Chi or yoga, and then there's deep breathing to help calm us, or meditation, or reading inspirational books. For the people that are on their own, very much alone and isolated, and there are many seniors in that situation, if you are able to call, there's a lovely friendship line, and if anyone has a pen and paper handy, I'm going to give you the number. You can call this number every day if you like and have a lovely conversation with somebody who's there just to be a friendly voice. And the number is 800-971-0016. And then in addition to that, I'd like to give you another number. It's for a service called Well Connected. And if you are the sort of person that would enjoy a stimulating intellectual conversation with a group of people over the telephone, you can call this number and they will tell you they've got many different groups, travel groups, and all sorts of clubs that you can choose whatever suits your fancy, and you can call and be part of the conversation. And to do that, the number is 877-797-7299. So I guess I would have to say, AJ, that my advice would be to reach out to find things that lift your spirit. And as AJ said earlier, don't forget to ask. Ask for help. Ask for ideas. Reach out, and the more you reach out, the more that will come back to you, and you'll find that the world is actually full of positive, beautiful people that want to care and help support us. So it's time to push out the negativity and try and bring in something that uplifts us.
This is such a nice way you have summarized it in the end, because a lot of times we forget that we can be thinking about all the negativity, all the negative things that are happening around us in terms of health situation or any other circumstance, event, whatever is going on. But then we forget one simple thing, that the best we can do is what is in our circle of influence. What can we do to make things better? And even as family member or as patient, one thing that we can always do is tap on the resources that are available and do things that will help us, whether it's as you mentioned, going for a walk, for example, if it's possible to be physically active, or some sort of companionship by talking to people. So it's what can we do? We all are in this together. So I think the key thing is what we all can do to make situation better than where we are today. And for that, we need to take positive steps.
Absolutely. And one of the things you're doing, AJ, is a lovely positive step by putting a warm, friendly voice out there to our seniors and letting them know that there are people that are here to help.
Excellent. I'm really thankful to you, Felicity, for really sharing, this tons of information, and I'm pretty sure listeners will really benefit. And, there are so many good people like you, the social workers. They do an amazing job because they're in the middle of everything. Coordination sometimes looks from outside that, okay, it's easy, you have the information and you're sharing the information, but as you said, that the situation is unique, so to coordinate that as per the need, it's very difficult in a way, but it's amazing that there are so many good people out there like you who are in this every day and helping the people who are in real need. So again, I would like to thank you for sharing this information and spending your time today with us.
Well, it's an absolute pleasure and it's an honor, and I look forward to meeting some of the listeners in the future. Take care, everyone.
Great. So thank you for joining us on Aging by the Bay today. The show was brought to you by ComForCare. We hope that you enjoyed the show, and please subscribe to our podcast that is available at iTunes, Google Play, Stitcher, and SoundCloud. You can find this show and also previous shows at our website, agingbythebay.com. We love your feedback, and so please leave your comments. If you do have any question for our featured guests or you want to become a featured guest, please contact us by sending us an email at info@agingbythebay.com. We will be back next Saturday, same time. And until then, be safe, take care, and have a great week.
This has been Aging by the Bay with Ajay Sani, addressing issues on aging and services for the elderly community. Join us again next week for Aging by the Bay.